Thank you, everyone. I'm David Bradley with the National Community Action Foundation, and this is a great day for America's communities, and this is a great day for the 1,000 community action agencies that work in those communities each and every day. H.R. 1695, introduced by Representative McCollum, Thompson, who are here today, Congresswoman Fudge, and Stefanik, is a terrific bill that meets the needs of low-income communities all across this country. The Community Services Block Grant, which was created in 1981, last reauthorized in 1998, needs modernizing and needs various aspects brought into the 21st century. This bill does this. This bill provides hope and opportunity and a pathway to self-sufficiency for tens and tens of thousands of individuals who are trapped in poverty across the country. Because of the leadership of Congresswoman McCollum and Congressman Glenn Thompson, we can look at three things in H.R. 1695 and know that what they are proposing is exactly what America needs in terms of dealing with distressed communities in this country. The bill that they've introduced preserves and strengthened time-tested principles, core values of the Community Action Program: low-income participation, local control, comprehensive needs assessment, and strategic planning in collaboration with important partners throughout the community. It reinforces and improves on performance measurements, not only locally, but state and federal as well. In this era of deficits and debt, in which every member, regardless of party, is asking for justification for spending a federal dollar, we know that what they have proposed in H.R. 1695 will ensure that precious federal treasure is going for and meeting the needs of what it was appropriated. And most importantly in this bill is that it cherishes and expands and refurbishes one of the most important aspects of the Community Action Program, and that is the laboratory aspect. Community health centers, Head Start, all came about because community action is a laboratory that has created so many of the programs that we take for granted today that are so successful. Well, because of the leadership of the four that have introduced this bill, we bring back a laboratory. We're going to be able to take the best that's going on in California and let New York or Ohio or Pennsylvania or Minnesota benefit from the research, the evaluation, and the success of those programs. So I'm excited about the leadership they've provided, and I know that this piece of legislation is a bill that we need going forward to make all of our communities stronger in the 21st century.
So I'm Betty McCollum, and I have the honor and privilege of representing the 4th Congressional District, St. Paul, Minnesota, in the U.S. Congress here. And David Bradley, thank you for all the work that you do, all the times that you've been in our offices fighting for community action agencies. I'd also like to thank Congressman Glenn Thompson for introducing this bill with me. I've gotten to know Glenn a little bit, and I look so much forward to getting to know him so much better as we work on this. And, you know, right now it seems like Congress is in a place where it can't agree much on anything. So I'm glad that Glenn and I together, along with our other co-sponsors, can show that people still here are focused on working on issues that are good for our country and issues that can bring Democrats and Republicans together. And that's exactly what CSBG has been doing for more than 50 years all across America. CSBG, as David pointed out, funds more than 1,000 community action agencies across the country. They're in each one of our districts, and they're working to combat poverty and to create opportunity and to support families. For years, these agencies have served as incredible resources to help low-income families escape poverty, and that means that their surrounding communities become stronger as well. H.R. 1695 builds on this success by reinforcing the existing efforts to improve performance and the management of community action at the federal, state, and local level. We know that community action agencies have consistently adapted to the needs of their local communities. And that's what makes these agencies so unique. Their boards of directors are comprised of people who benefit, like local elected officials, private and nonprofit members, and the very recipients who apply these formula-driven opportunities to improve their lives. The effect of this input, as David says, makes these programs a laboratory for innovation. With this reauthorization, we're going to include a community action innovation, which are going to allow agencies to test new approaches, to modernize problems, and also to collaborate with best practices with fellow stakeholders across the country. Simply put, this program will ensure that every American dollar being spent will be spent in the most cost-effective way possible. And finally, this reauthorization of CSBG addresses the important role that community action agencies are already playing in combating the opioid crisis. We all know that the opioid epidemic has been devastating our communities throughout America. Community action agencies are uniquely positioned to help to combat this crisis due to their existing infrastructure and their partnerships. This reauthorization will support a wide range of activities designed to prevent, treat addiction, stabilize families, help the individual who's addicted, but more importantly, it will support those children of those who are suffering with this terrible addiction. We have seen the incredible influence that these agencies have on the communities they serve. And I know that if we give them the tools that they need, countless families across this country will have the tools that they need to create more hope, more opportunity for themselves, for their families, for our communities, and our nation. Now, as you can tell, I am excited about this legislation. I'm very excited about my partner in this legislation because I know how committed he is. So, Congressman Thompson, I look forward to working with you and hearing what you have to say today. Thank you for being my partner.
No, thank you, David. Thanks for your leadership. Hey, good morning, everybody, and thank you for coming out today. This is an exciting day. This is a day that is long overdue, actually, by 2 decades. I'm so proud to be here working with Congresswoman McCollum, working with a great partner who is a great voice for our community action agencies across almost every county in this country. On H.R. 1695, a reauthorization of the Community Services Block Grant. This is a program that I don't think. I would hope that all of our citizens are aware, and certainly all of our colleagues, and our goal is to make sure that they are fully aware of this program, because it's such a force for good. This is the only federal program that addresses poverty regardless of the cause. And that's the American dream, right? It's lifting people up. It's providing access to greater opportunity, restoring rungs on a ladder of opportunity. And our community action agencies are just amazing. It's one of the best, I think, one of the best examples of public-private partnerships. Because as Congresswoman McCollum referred to those board members, they're citizens, they're community members. Some of them are elected officials, some are involved in different agencies, some of them are just have a heart for serving their neighbors, of helping their neighbors that are struggling, their neighbors that have been living in poverty. Maybe it's been for months, maybe it's been for generations. To provide the type of leadership with these community action agencies. And the great programs that they do. And we talk a lot about the program. We hear about Head Start and Weatherization. We're talking about dealing with the public health crisis of our lifetime, which is substance abuse. Right now it tends to be opioids, but that will change, but the scourge will be there. And especially in this day, in 2019, I think you're going to be hard-pressed to find a zip code in this country where you don't have some prevalence of poverty, and certainly some prevalence of opioid addiction and substance abuse, which is, can lead to poverty or be or unfortunately be, concurrent with some folks struggling in poverty. So, I'm so excited about this reauthorization. I said it's overdue. It's been 20 years. There's a reason we reauthorize bills here in Washington, in the legislature, in the federal government. It's to update them, to make sure that we refine them. We make sure that, the good things we perpetuate, and changes that we need to make to improve things, that we do that. And this bill does that. It's very exciting, and it's long overdue. The 20 years that we've had here. If you've, and maybe people are more familiar with, when it comes to community services block grants, with the program names like Head Start, like Weatherization, and many others. But what they need to be familiar with are the outcomes. The outcomes, how it impacts the lives of individuals and families and ultimately communities. And so one of the things I love about the reauthorization we put together is the ability to pivot and to have local control, because not every community has the same needs. And when you're working with a board, you have your board of these community action agencies. These are people that have their finger on the pulse of those communities. They know what are the issues that are leading people and families into poverty. What are the issues that people living in poverty are experiencing that are barriers to getting out of poverty? And so the fact that we really provide an ability to pivot, an ability for local input on an agency level, that we're not in a cookie cutter way defining poverty or the barriers or the pathways out from Washington. Anytime we do that, usually doesn't work out very well. And the fact that this bill really does empower at the local agency level. So I'll just very proud to be here. We've got I don't know what our final count was, but we're off to a great start in a bipartisan way. People, as we worked the floor, it was hard pressed to find, the only thing that limited more original co-sponsors was the time we had to have the conversation with them. The results, the response across the aisle was just wonderful. When our members or colleagues have the opportunity to find out about these programs, this reauthorization, how we want to modernize it a bit, continue and perpetuate the things that are working so good today, it was hard pressed not to get a yes from them. So that's what we're hoping for. This morning, the Education and Labor Committee had a member hearing for members to present their priorities for the 116th Congress. I'm a senior member on that committee, and I was proud to be able to address the committee this morning and outline my priorities, which included the reauthorization, long overdue, of the Community Services Block Grant Program. So I think we got great momentum, and now we just need to keep building that momentum. We're encouraging our colleagues to sign on. This is a bill that I can't imagine. It's Congress. There'll probably be somebody not support, but I can't imagine. There'd be very few that wouldn't support this when they truly understand the outcomes of what it does, again, for Americans, American families, and for our communities, whether it's in urban areas or very large rural areas. There's 18 members of Pennsylvania in Pennsylvania. I represent 24% of the land mass, so it's a very, very rural district. So you're looking at urban, suburban areas and rural areas, and quite frankly, the Community Services Block Grant is so important to all of America.
Mm-hmm. So, we look forward to people's reactions. We need your help also in contacting legislatures to sign on to the bill and to share your stories of how impactful this program has been over the decades, and how we can tell your story, share your story, and make sure that there's more hope and opportunity after this bill's reauthorized. And we have an authorizer, I'm an appropriator, we're going to get her done. So David, thank you for bringing us together. Thank you very much.
Thank you.
And that's it.